Yeah, just a quick review of the shoulder surgery pillow. Basically, this is a pillow you would use after you have any kind of shoulder surgery. Basically, because it's really hard to sleep at night with an unsupported arm. And so after surgery, you have a certain amount of inflammation. Obviously, it's really hard to lay on the affected arm. So what you need to do is lay on the opposite side, but in doing so, your shoulder needs a little bit of support. So that's kind of why they came up with these kind of pillows, these kind of surgery pillows. So this one here, but the other thing to keep in mind too, and a lot of people probably won't go looking for these unless they have had surgery, but you can also use this if you're like a side sleeper and just need some support for your arm. Um, uh, so there are other reasons to use this. You don't necessarily have to just have surgery. Make actually a really good pillow just to support your arm while you're sleeping on your side. If you have just shoulder pain in general as well. Always good to sleep with that arm supported. So this one is kind of unusual. It has a few features that I really like about it. Basically, one of the biggest things I've noticed is that it has this thumb strap on it. So that when you're sitting or if you're standing, you hook your thumb into it and it gets some more support for your arm. It also has, let's see, you can use this for your right or your left shoulder, so you don't have to worry about buying a left or a right. It's also got a pocket on it that you can use to store stuff in, which is kind of cool. Haven't really seen too many of that. It does have adjustable Velcro, so you can get it as tight or as loose as you want to. And let's see. Oh yeah, the other thing, yeah, is that it's got a zipper in it, and you can actually take some of the fill out, or you can even add some to it. It's kind of adjustable in that sense. Well, let's say if you get the pillow is just too bulky, you can actually unzip it and take some of the fill out. So I think that's a really good feature of this thing, because it isn't always necessarily one size fits all. So yeah, if you've had shoulder surgery and you're really looking for a good pillow that's really versatile, has a few extra features that you don't see on a lot of other pillows, I think this would be a good choice. Now, if you also have had surgery, one other thing you might want to consider, especially like rotator cuff surgery, there aren't that many good rotator cuff books around, so this is another good resource for people that are either, if they're looking at rotator cuff surgery and they want to avoid it, or they've had it and they need to do some rehabilitation for it. This is the 6-minute torn rotator cuff solution. It says for seniors, but anybody can use this, even an athlete can. This is kind of like the Bible if you've had any kind of rotator cuff problems. Or let's say they did one arm and maybe you want to avoid having surgery in the other arm. You have 2 rotator cuff tears, one in each arm. So it just basically starts out with some basic anatomy, a lot of pictures in this. If you're a visual learner, it makes it real easy to get through the anatomy. Then they come up with a question and answer section. What are the symptoms of a rotator cuff tear? What tests are used to diagnose it? Where does it tear at? About every question you'd ever want to know with a patient with a rotator cuff tear, this will answer. Are there different kinds of rotator cuff tears? Here's a real good one. I have a rotator cuff tear and I'm in a lot of pain. I need surgery, right? Well, not necessarily, and I'll tell you why. This is a very evidence-based book, so it uses studies to answer its questions. Each one of these boxes is a different study in layman's terms. So they answer that question by looking at studies where they say take 100 people with a rotator cuff tear, okay? And then what they do is they measure the size of the tear, and then they measure how much pain people are in. So then you have 100 people, how big their tear are and how bad they're hurting. Well, what they find is there's actually kind of discrepancy that you would normally think. In other words, they can find a lot of people with big rotator cuff tears that have no pain. So it's a real thing that, and lots of studies have duplicated this. It's entirely possible to have a rotator cuff tear and have no pain. So you don't necessarily want to jump into rotator cuff surgery just because they found a rotator cuff tear, because you could have an asymptomatic tear and something else is really causing your pain. So that's a real thing. So that's why just because you find you have a tear on an MRI and you're having pain doesn't mean you necessarily have to have that thing fixed. What would happen if I just leave my rotator cuff tear alone? That's the first thing a lot of people want to know when they find they have a tear. Well, what if I just let it go? Will it get better on its own? Here again, look at the long-term follow-up studies where they say take, I'll say 100 people with a rotator cuff tear, and for some reason or another, they just never get around to getting anything treated or fixed. So they follow these people over a period of years and they find out what happens to it. Does it get better? Does it get same? Does it worse? Does it repair itself? Here's probably the best one. How does exercise compare to surgery when it comes to treating my torn rotator cuff? So really, the only way you can answer that is by doing looking at the randomized controlled trials. And this book has compiled the randomized controlled trials. That's the highest form of proof in medicine that a treatment is actually effective. So let's say they take 100 people with torn rotator cuffs. 50 they randomly assign to surgery. The other 50 they randomly assign to exercise program, and then they follow them over time, like 6 weeks, 6 months, 6 years. And there's some really good long-term follow-up studies. So they follow them and say, okay, so after like a year, after 2 years, who did better? The people that just did exercise or the people that had their rotator cuff repaired? And basically, make a long story short, you're going to end up at the same place. So anyway, have some good exercise program here. There's 3 different levels of beginner, intermediate, advanced. There's stretches and strengthening. So if you need any kind of resource for that, that's great. However, if you've had surgery, and you're just looking for something to kind of, ease that pillow, ease the pain when you're sleeping, this is a great choice. So definitely check it out.